It is just a huge honor today to be in downtown Phnom Penh, the capital of Cambodia. Cambodia is 15 million people. This is the capital of Phnom Penh, has about 2 million. And this, I am with Dr. Tith Yoeu. Did I say that right? Dr. Tith Yoeu. Your dental office is a 10-story building. This is the largest dental office in Southeast Asia. And so it's just a huge honor that you invited me up on the 8th floor of this gorgeous dental office. I've been taking a tour of it. It's just amazing. Dr. Tith Yoeu is the head of oral surgery and implantology at Roomchang Dental Hospital. So that's what he calls this, Roomchang Dental Hospital. And Roomchang means it's Cambodian for water lily. He's also the hospital's director and founder. He graduated in General Dentistry in 1995. 10 years later, in 2005, he graduated as Doctor of Dental Science from the Faculty of Dentistry, University of Health Sciences of Cambodia. He was awarded the prestigious certificate in Oral Implantology in 2003, and in 2015 became a Master of Science in Oral Implantology. Both awards were gained from Goethe-Frankfurt University in Germany. Dr. Tith is the successful pioneer of a one-step approach in autogenous augmentation and implantation using a bone ring technique. This revolutionary technique is used in implant placement and full mouth restorative procedures. It allows numerous surgeries over months, sometimes years, to be done in one appointment. This research was presented in his thesis and will be published later this year in Germany. During 20 years in private practice, Dr. Tith has regularly attended and continues to attend dental training programs, seminars, and conferences all over the world. Internationally recognized as an exceptional dental practitioner, Dr. Tith encourages and monitors the advanced training of all Roomchang's dentists. He can speak Khmer and English. It is just a huge honor for you to be on our show today. How did you go from a little boy to all this?
It is a long way. It's a hard working, and it's a passionation to grow up from a boy during the war time in Cambodia, as many of the people in my generation who are struggling in the Khmer areas. And the hard working can bring me for loving to study hard and to work hard. And year by year, we keep moving forward until we can reach to today.
So what year were you born?
I was born in 1974.
1974?
Yeah.
And when was the dark times of the Khmer Rouge?
It is between 1974 to 1979. Yeah.
You were born in 74?
Yeah, during the beginning of the war.
So you were born in 74.
Right.
And the Khmer Rouge was 74 to 79?
Yeah, right.
And how many people, some people say that they killed 30% of Cambodians. Is that correct?
They killed almost 3 million of Cambodians.
3 million out of how many?
Also about 7 million.
Out of 7?
Yeah.
So they almost killed half the country.
Yeah, almost. Some are intentional kill, some by disease or starvation. Yeah.
And what were they trying to accomplish? I mean, why do you think it happened? What was the Khmer Rouge thinking?
I think that the ideology, because of the leadership of the Khmer Rouge, they want to be prominent, and they don't want to have more people to challenge them. So they have to remove all educated people out. Yeah, and in a very short way, you would say, is less competition. Yeah.
So they killed all the dentists like you and me?
Yeah, they kill all educated people. If you, you look like you are handsome, you are clean, nice, they think you are officer, you are business, or you are diplomat. So you are the first target for them. If you look like a farmer, a poor worker, they don't care. But those educated, with spectacle, that is the most targeting. Yeah.
So did you lose a lot of members of your family?
Yeah, I lose my uncle, auntie, other family member. Yeah, but my sibling all safe during the Khmer Rouge. Yeah.
And what about your mom and dad?
My mom and dad also survived after the Khmer Rouge. But we live in the jungle during the Khmer Rouge, so it's not very, very big killings community. until the end of the Khmer Rouge periods that they tried to kill my father, but my father escaped it to others area and he's safe. Yeah.
But that obviously must have had a very big impact on you. And do you think that was one of the reasons you worked so hard to rebuild and became so successful?
I think that the hard work is still in my mind for 24 hours a day from the childhood that I wake up in the morning, you don't know where is the breakfast is. Yeah, you don't know where is the shower. Yeah, if you want to look for toilet, you run out to the backyard looking for some small tree to escape from the eye of other people to use it as a toilet. Yeah, and when you are hungry, you just wait and listen to the bell from the community canteen that they rang the bell, and you run to the canteen and they will give you a small piece of rice, sometimes a small piece of fish together, yeah, to eat that. That's all. Yeah, so it's very hard time, and there's no market, no school, yeah, no hospital. Yeah, it's 0 year because it's a dark and 0 years. So we survive from that is like by luck, not by anything. Yeah, maybe my parents care me, teach me how to make my own hygiene to protect the infection. Yeah, and that's all. So there's no medicine. Yeah, when you get stomach pain, I climb to the guava tree and take the new leaf and eat. Yeah, and it stops stomach pain. Yeah, or sometimes we get a big diarrhea. Yeah, we eat more of kind of the guava leaf to improve the digestion and it stops the stomach. Yeah, if you feel any like hot temperature, you go to the backyard looking for the ginger, and you take the ginger, you snap it, put it in the hot water and drink. That is medicine. Yeah, and I can find the medicine myself. And now I feel like it's a good practicing because sometimes I met friends who get some problem. I just ask them, okay, why don't you drink the ginger? After ginger, 1 cup of hot water, they feel better, improve. Yeah.
I'm here with 3 of my boys, and we went to the Genocide Museum.
I see.
They always say history always repeats itself.
Yeah.
Do you think something like the Pol Pot and the Khmer Rouge, do you think that could happen again in Cambodia way out into the future? Do you think humans can do that again?
I don't think anyone in Cambodia want to go back to that time. Yeah, because the influence from making the Khmer Rouge is by the Cold War's effect. Yeah, it's not by local people alone. Yeah, during the Cold Wars, the influence from the West and the communists try to make this area to be like either going to pro-communist or either pro-Western, and it makes thinking philosophy change. And the people one part want to say, oh, I want to be like American. One part say, no, I don't like this fancy. I want to be polar like a communist. And this one create the war in Cambodia. So this create internal conflict and create the civil war. And civil war in Cambodia lasts very long. It's starting maybe since 1970. Yeah, at the beginning. Yeah, and it ends until year 2000. So it takes 30 years. Yeah.
It started in 1970?
Yeah.
And went to 2000?
Yeah, and year 2000. And that is the period of no fighting. Yeah.
No writing?
No fighting.
No fighting?
Yeah.
So do countries like Cambodia, Laos, Bangkok, Thailand, Vietnam, Malaysia, do they feel like they have to lean towards either communist China or the democratic United States? Do they feel in the middle, or do they feel they can be alone and independent?
I think the influence of this balancing is causing from colonization, like in Malaysia, Singapore. Yeah, they already like coming out from British, so their philosophy, their feeling is already close to the Western. Yeah. So after
Because they were colonized.
Yeah,
Singapore and Malaysia were colonized by Great Britain.
Yeah, Great Britain.
And then Vietnam was colonized by the French.
By France, Cambodia, Vietnam, and Laos, colonized by France. So we have part influence between Western and between communists. Yeah.
So who was it better to be colonized by? The French in Vietnam, Laos, and Cambodia, or the British in Hong Kong and Malaysia and Singapore?
In easy conclusion, we can see that those countries who colonized by France, yeah, when they leave back, they are struggling in war. Yeah,
they're in war.
Yeah, they don't have any support to set up like healthcare systems, education system, and a legal system. Yeah, this is the problem that can keep the
from the French.
From the French, yeah.
So you think the British colonies were better because they set up a healthcare system and a legal system?
Education system too. Yeah.
So the British was better?
Yeah.
Interesting. So on your journey, you're a little boy. When did you decide to become a dentist? Do you call it dentist or stomatology?
It's dentist.
Dentist?
Yeah.
So when on your journey, out of nowhere, did you decide you were going to be a dentist?
I first, after high school, yeah, I don't have intention to be a dentist. I want to be engineer or architect. But in that time, the place in university is very limited for dentists, for engineer and architect. So I just apply for different university for entrance exam, and I passed dentistry. So I start dentistry.
Yeah. And what year was that?
In year 1990.
1990?
Yeah.
Here in Phnom Penh?
In Phnom Penh, yeah, right.
And was that at because they have 5 schools. They have a university, they have a government university,
right,
a military dental school, and 3 privates?
In that time, it's only 1 dental school.
And that was the government?
Government, yeah.
And so how long did it take to become a dentist in those days?
I spent 5 years.
5 years?
And it's not fully like we call doctor of dental science. It's just like dental physician. Yeah.
Dental physician?
Yeah, yeah.
So so you graduated in 1995?
Yeah, 1995, yeah.
And this is just 2017. So that's only 22 years ago.
20 years, yeah. 20.
How do you go from 1995 to a 10-story building and have a dental office with a reputation all over Southeast Asia?
Yeah, that is one step that I start to change from early stage. Most of the graduate students during my time, they will go to government work because government also offer that if you want to work for government, you can go to rural area in the countryside to work there for 3 to 4 years, and you can move back to the big city. And I was accepted by government to work in my hometown. So I went to my hometown for 1-2 days, and the head of the referral hospital, he just say that if you come here, we don't have a good treatment room for you, but if you have a barber shop, you can set your clinic here under the tree. So I feel like I don't have a very good welcome from the rural officer, and I say that if you think that I'm not very important, can I go back? And he say that okay, it's up to you, yeah, because if you stay, we don't have good place for you too. So I start to live from there. I went to have my own thinking how to improve in dentistry, not only myself, but how to transform dentistry in Cambodia to a better way. So by then I come to the city. I start to work with my sister-in-law, who she have a very small practice, and I start to travel to neighboring country. First I went to Vietnam because that time having the visa to other country is not possible. We are in the economic sanction, so it's not possible to have the visa to Western country. Even from here to Singapore, also different country, different block. Yeah. So I went to see dentists in Vietnam. I feel like they are better than us because they stopped the wars in 1975 and they don't have dark like 0 years like Cambodia. So their development is faster. Yeah, and I learned something from them. And they also start to have private dental supply from Europe, from different company to Vietnam dentistry. And I also learn about product. And I come back, I buy some equipment. The first equipment I buy is autoclave. I think that to have a good dental practice, the autoclave is important. Yeah, the second equipment that I buy is the oil-less compressor from Italy, but it's sold in Vietnam. So I think about how to keep it clean. Yeah, to make a good filling, you need a clean air. Yeah, not the compressor from the factory, from the industry. So I start by that. Yeah, we buy the good suction system to make sure that the workflow is good. Yeah, little by little, every time we buy new equipment, the patient see that we keep improving, more patient support. Yeah, all the income from the patient we reinvest into the material and equipment, and also I reinvest into myself for education. Yeah, after a few years in Vietnam, I found that the dentistry in Vietnam is not to the high end. They are limited. So I moved out from Vietnam. I visit Singapore University for one time. I find that they are very strong. Yeah, and I went to visit Malaysia. I met some friends and I learned something from them. I have one good friend, Mr. Richard Tith. He's very good, one of the early dental technician ceramists in Malaysia. He spent a lot of time overseas for training. So yeah, he introduced me to some of the dentists in Malaysia. So I met one of the good dentists, Dr. Sim Tang Eng. He is a very early dentist who started implant in Malaysia, and he also very successful in that time. But unfortunately, in the year 2012, he get heart attack and passed away. Yeah, but it's good point for me to meet all those friends. And I keep saying to them that they are very good people. They give me the idea and clue. Yeah, even they don't give me cash or they don't understand what I want to grow, but at least I can understand what they have, what they show me, and they also introduce me to other people. And by then, in year 1998, I have the chance to went to University of Malaya for private clinical attachment. I met many professors there. I learned part by them. And in year 2001, I joined the training program for implant with Malaysian dentist team to Frankfurt. So I start my implantology in the year 2001. Yeah.
So you come out of dental school in Cambodia.
Yeah.
And you studied in Vietnam, Singapore, Malaysia, Germany.
Yeah.
5 countries.
Yeah.
I mean, you're the Marco Polo of dentistry. I think you went to more countries than Genghis Khan.
But it's not end. Yeah. During my time in Germany, I also spent 2 weeks with one of the very early periodontologists. Yeah, his name is Professor Umberto Ba. And I think now he's so alive, he may be close to 100 years old. Yeah.
So I always call it a, if you're going to be an armchair economist, I've lectured in every continent but Antarctica. I think one of the easiest barometers you can tell if a country is growing is what we call the crane factor. Yeah. And you go to many old world countries and they're not growing. You can't see a crane anywhere. Yeah. And you look around this horizon, I mean, I cannot count the cranes around Cambodia because every crane, like that building there, how much US dollars do you think that building is going to cost to build that building?
I think that for this closest one,
yes,
maybe it costs about 4 million.
4 million?
Yeah.
4 million US dollars.
US dollar, yeah.
So whenever you see a crane in a city, Someone's made a $4 million bet on this town.
Yeah.
And when you go, you could drive around Italy
Yeah.
for a month and never see a crane.
I see.
But when you come to Cambodia, there is, or Southeast Asia, there's so many cranes you can't count it. And the second thing is children.
Yeah.
You go to some countries that have like Japan has 2 years economy in debt. So so their GDP. 2 GDPs is how much debt they have. The United States has 1 GDP debt, but you just don't even see babies running around in Japan. But you come to Southeast Asia. We went all the way to Angkor Wat yesterday.
Yeah.
All you see is cranes and babies running around. So Cambodia is exploding economically.
Right.
It's just,
I believe too.
yeah, it is just, and so is Malaysia.
Right.
I mean, it's just Southeast Asia. I mean, when you see cranes and babies everywhere, that's a growing economy. I have a specific question for you. These dental students, is the only way to be a successful dentist in the large metro city like Phnom Penh, the capital, could a dentist be successful if they were 2 hours up the river in the rural parts of Cambodia? Can you be successful in rural Cambodia, or do you need to be in the big urban metro center?
Because of the economic development in the city is very enormous compared to rural areas. So if you're practicing high-end dentistry in rural area, it may be very limited patient. Yeah.
For high-end dentistry?
Yeah, right.
But is there money in low-end dentistry?
Yeah, there's some, but not to say like...
Not much?
Yeah, much potential, yeah.
So you are a pioneer in a specific type of dental implant technique.
Yeah.
We talked about this.
Bone ring technique.
Yeah, the bone ring technique.
Yeah.
Talk about the bone ring technique. And I'm hoping. Do you think you would ever grace our website? Do you ever lecture on it? Teach on it?
I didn't ever prepare for that.
Really? Do you have any presentation on that?
I haven't.
Would you ever consider putting it on Dentaltown, or is it a proprietary technique?
I don't mind to share. So far, I used to do some presentation in international conference in Germany.
Yeah.
And next month there will be the first World Bone Ring Congress that they will gathering all the people who love the bone ring technique in Frankfurt. So I will be there for once.
Would you mind creating a bone ring technique for us on Dentaltown?
Yeah, I need some guy from you how to make it.
Send me. Do you have my email? I'm howard@dentaltown.com.
Yeah,
send me an email, Howard at Dental. There's 2 Howards. Howard@dentaltown.com, and the guy in charge of the online C is Howard Goldstein.
Yeah.
So he goes by Hogo, Hogo at Dentaltown.
Yeah.
But so tell everyone about your bone ring technique. Many people have never even heard of it. What is a bone ring technique?
Yeah, bone ring technique is a way that we can do bone 3-dimensional bone augmentation and implantation at the same time. Yeah, most of the international speaker, they have talked like if no bone, no buccal bone, no implant. Yeah, but since I love the implants, and I find some challenge how to make it fast, mostly to satisfy customer who broke a teeth and they want to smile in the next few hours for public appearance. So how to solve this problem? So I keep thinking that only geometric augmentation that is very well adapted can be the most stable solution. So I start to do some bones harvesting using the tram file and transfer it, adapt it to diameter of the implants, and the same time I can put a temporary crown. So if the patient comes, they broke the teeth, there's infection, no bone, yeah, we can remove the infected bone and tissues out. We can put the bone ring inside and we do the implant straight away, and we can put a temporary crown. So it means that we are super speed. Yeah, conventionally when the patient comes with infection, You will take out the tooth and you wait for 4 months. After 4 months, you will start to look how to do bone augmentation, either using the granulate grafting or either using the block grafting. And after that, you have to wait another 4 to 6 months, and you start to re-entry for implantation. And you wait another 2 to 3 months, you restart again for re-entry for recovery stage. And you wait for 10 days or 2 weeks, and you start to do impression. And after that, you can do the crown. So you start this way, you will lose 4 months for waiting for the primary healing stage. You wait another 4 months for bone augmentation stage. You wait another 2 months for the implantation stage. And until you finish, maybe you take about 10 to 12 months. Or sometimes you take up to 16 months. Yeah, it's much longer, 16 months. Yeah. But with my step, I can finish the cases. Yeah, if I don't rush, I can wait for 4 months. If I rush, I can wait 2 months and I can finish in 2 months. Yeah.
Wow. And did you invent this?
Actually, I'm not the inventor. It was invented by Kissenhagen, who do it the bone ring technique. He's in Frankfurt. Yeah, he do the ring technique, and yeah, he do some lecture, but I never met him. I never heard anything about him. Yeah, so he do his way. Yeah, years later, I did my way, and in year 2003, yeah, I went to Berlin for some biomaterial conference, and I met Kissenhagen. So he showed his technique. He do many stages. Yeah, he do similar to the basic concept. Just one shortcut, like when you do extraction, he straight away put the ring, and he start to put the implant, and he wait, and after that he do the graft, tissue graft again, and he can start the prosthesis. So I find that I also do rings, but I do different approach. And he say, what you do? And I told him what I do. He say, how can you do that? I say, yes, I do this. And he say, do you see me before what I do? I say, if I see you before, maybe I never do my way, because I never see what you do before. That's why I do my way. And it come to be different challenge. And 2004, I went to Frankfurt for master program, and I talked with professors, I talked with college, and I found like my technique is very different from others. Even we use geometric rings concept, but the approach is different. Yeah.
So Ryan, what do they call that code discovery? I mean, when Darwin discovered evolution, someone else published a paper on it within that year, and then like the pyramids popped up in Egypt. I mean, all over the world. So so it's amazing how the forces. So two guys developed a technique independent of each other about the same period of time.
Yeah, maybe they are early than me.
Yeah. But it's interesting how humans do that. I mean, they kind of co-invent without knowing each other.
Yeah.
I mean, there were two papers on evolution. There were
parallel state.
Yeah.
But he's in Germany. He's more active than me. He set up the core. He go for a lot of training program. Yeah. I was busy during that time. I started the ring technique. I'm building this hospital, so I'm so busy take care of starting from the piling to the rooftop.
Yes.
And I seem to be like I cut off from the communication to the outside dentistry for 2 years.
Well, you talked about this other gentleman. He was in Frankfurt, Germany.
Yeah.
And you're in Cambodia.
Yeah.
Dentaltown is about 81% United States and Canada. It's 81% is United States, Canada, Australia, New Zealand.
Right.
So those 4 countries are 80%.
I see.
And then the rest of the world is about 19.5%, almost 20%.
Yeah.
But I would imagine almost everybody listening to you has never heard of the bone ring technique, especially the United States and Canada, Australia, New Zealand. And I would really, really hope that you do a presentation on Dentaltown
Yeah.
and show them your amazing technique. That would be. Do you think you might do that?
Yeah, if I understand how to do it.
Yeah. Well, what we do is everybody. We have 350 courses. Everybody does it different. Some upload PowerPoint and then just do a voiceover.
Yeah.
Some people film an existing presentation and it's a video.
Yeah.
But there's 100 ways to do it. Some do it over Skype. Record. We could do it a lot of different ways. So let's talk about this office. So what year did you break ground? This is a 10-story building.
Yeah.
Did you build the building or did you buy the building?
I built the building.
You built a 10-story
Yeah,
building.
I design and build myself.
How does a dentist able to borrow money to build a skyscraper in downtown Cambodia? I mean,
In that years, I have lucky years that I sold one property outside the city, and I got the money to buy this land. And later I sold another two property for $1 million, so I get the capital to start this construction, and the rest I talk with the bank. Yeah.
Nice. And so how many dental operatories are in this 10-story building? How many dentists work here?
We have 33 dentists. Yeah.
33 dentists?
Yeah, and we have 3 foreign dentists, 2 from New Zealand and 1 from France.
2 from Newfoundland?
New Zealand, yeah.
Where?
From New Zealand.
Oh, 2 from New Zealand.
Yeah, and 1 from France.
So the New Zealand, those are called Kiwis?
Kiwi, yeah.
So you have 2 Kiwis from New Zealand,
and
1 from France,
1 from France.
and then 31
dentists
31 dentists from Cambodia?
from Cambodia.
So 31 from Cambodia?
Yeah.
2 from New Zealand, 1 from France.
From France, yeah.
Unbelievable. And how many chairs do you have in here?
We have 36 chairs.
36 chairs?
Yeah.
And you call this a dental hospital. What are the hours of a dental hospital? Are you open every day?
Because when in the law of Cambodia, they say that when you have small clinic, like 1 or 2 chair, they call cabinet. Yeah, it's like consultations. Yeah, when you have up to 10, they call it a clinic. Yeah, but when you have more than 10, it can be a polyclinic or can be a hospital.
Okay, so when it's 2 chairs, it's called a consultory?
Yeah,
consultory. A consultory for consultations?
Yeah.
And when it's 3 to 10, it's called a clinic.
A clinic, right.
And when it's over 10, it's called a hospital.
A polyclinic.
A polyclinic.
Yeah, but we are more than 20, so I try to apply as the hospital because we also have a potential to do more work. Yeah.
And so are you open, are you open every day? 7 days a week?
Open in this main hospital, we open from Monday to Saturday, but we have another branch outside this building. We open also on Sunday. Yeah.
So, what do you do in this? Do you do everything? Do you do pediatric dentistry, endodontics, periodontics, implantology, orthodontics? Do you do everything, or is there some things you don't do?
Yeah, I do myself. Now I only do the implants and reconstruction work. Yeah, but my college, we have different specialists. We have 2 pediatricians who take care of the children. We have 6 dentists who doing orthodontic. Yeah, we have 1 periodontologist. We have 2 prosthodontists. Yeah, and the other are GP.
And what is the high-end procedures that are selling in Cambodia? Is it mostly implants? Is it orthodontics? Is it cosmetics? What are you guys doing mostly?
Yeah, we do the orthodontic department. They have full of their patients for orthodontic work. Yeah, implants department, we have a lot of implant cases to do it, and also we do the prosthodontic. Yeah, and the GP they can do restorative, and also they can do crown and bridge. Yeah.
And do you have the crown and bridge lab in this building, or do you send out the crown and bridge to a lab?
We have one internal lab who do only the CAD/CAM system. Yeah.
You have your own CAD/CAM lab?
Yeah, CAD/CAM lab.
And which CAD/CAM technology did you go with?
I adopted with the E4D.
E4D?
Yeah.
Out of Helsinki, Finland.
Yeah, E4D is originate from Dallas, Texas.
Dallas, Texas.
Yeah.
Yeah, E4D's in Dallas, Texas, and it was just bought by Plan Mecca.
Yeah, they bought by Plan Mecca maybe 2005. Yeah, 2 years ago.
And why did you go with E4D?
It was introduced by my friend from Malaysia, Mr. Richard Thai, who is a master technician. And he said that, okay, please go and join the E4D training. And I found that the concept is convenient, and I decided to buy the machine just before the opening of this hospital. Yeah.
So what percent of your crowns are CAD/CAM made by E4D? What percent of them?
Maybe 80%.
80%?
Yeah.
And who makes the other 20%?
The other 20% we do either zirconium based or PVM that we send to outside lab, our partner lab outside. Yeah.
So you have a partner lab?
Right.
Do you own the partner lab?
Yes.
And is it in Phnom Penh?
Phnom Penh. Yeah.
Wow. And how many people work there?
About 80 technicians.
80?
Right.
Is it here in town?
Yeah.
Oh my God! Can we go see when you have patients at 9, right?
Yeah.
Can you tell the tok to take us to the lab? And
Yeah, I will ask.
is it close by or is it far away? It's not far.
Yeah.
So do you like the lab business?
Yeah, it is a challenge to make the first modern dental lab in Cambodia in the past 15 years. So I start that lab, and after that I joined with my friends, and the lab just keep growing up, and we get more and more people in.
You are amazing. You are so amazing. I mean, you started the first high-tech lab.
Yeah.
You started the first dental hospital.
Yeah.
I mean, you are really a blazing pioneer.
Thank you.
I mean, it is truly amazing.
Yeah.
So, Cambodia, it's still, the dental schools started dental therapist just 3 months ago, right?
Right.
Well, what are your thoughts on dental therapist entering Cambodia?
Actually, there's nothing strange that in US you are doing the dental hygienist. Yeah, so the dental hygienist in US, you can let them to do basic work like cleanings, polishing, and also a lot of work to support dentists. But they are always under supervision of the dentist. Yeah, but unfortunately in Cambodia, the dental hygienist here, the government give them the independence right to start their own practice. So there may be a lack of supervision to make sure that they are doing in the right way, because the period of education from school is only 3 years.
Is 3 years?
Yeah.
And how many years is a dentist?
The dentists here, they start at 6 years or...
So to become a dentist in Cambodia is 6 years.
Right.
And to be a dental therapist is 3 years.
3 years.
And what you're saying is that you think that the 3-year dental therapist should work under the supervision of a 6-year dentist.
Right.
But by giving them independent practice,
Yeah.
that they don't have the proper supervision.
Right.
So you don't agree with this?
I don't say that I don't agree, but I can say that it's not a good solution to give them independent. Yeah.
So do you think the Cambodian Dental Association will be able to work with the Ministry of Health to change that? Or do you think it'll be very hard to change?
Because the law was passed by and signed by the king, so it becomes a big challenge to amendment this law.
Yeah. And are you a member of the Cambodian Dental Association?
I do.
I had dinner with the president of the Cambodian Dental Association. She said there were 430 members, and she thought there were 1,200 Cambodian dentists. How many dentists do you think are in Cambodia?
Yeah, about 12.
1,200?
That's 1,200.
So do you think if all 1,200 members were members of the Cambodian Dental Association, they would have more money and clout to change the dental therapy law?
It takes years to change that. Yeah, I have not much belief because it was implemented already. Yeah, after they approved from Parliament and passed to the Senate and passed to the King. So the King signed and they put the law into practice. What we are react is after the law is already completed. If we know early stage and they start to react at the early stage, it maybe can change some clot inside that. But right now the government also put like they will limit the work to the therapist, not to give full right to do every work. Yeah, they say that if the case is complicated, yeah, the therapist cannot do. You must transfer to the dentist. But we don't know how we can limit it because nobody they put their eye on them. Yeah, that is very difficult part. Yeah, and also as you see that to be a good dentist, it's not just 6 years in school, but like for me, after 5 years in school in that time program, yeah, I spent another 20 years for continuing education. Yeah, so it takes years and years to come to a skills and reliable, yeah, practicing dentist.
Well, when you go around the world, whenever you have a what the dental associations really are is a liaison between the practicing dentist and your local government. And when you don't have a strong dental association working with your government, the government oftentimes does things that hurts our profession. I've seen it in Brazil. I've seen it in India. I see it's slipping away in the United States where membership is, when I got out of school, it seemed like 80% were members. Now it's down to like 65%. The American Medical Association, the physicians, that's less than half. But so you have 33 dentists.
Yeah.
Do they do all their cleanings, their own teeth cleanings?
Yeah.
They do their own cleanings.
Yeah, right.
What do you is orthodontic? A lot of countries in the last 10 years have seen Invisalign explode.
Yeah.
I mean, your dentist friends in Singapore. Invisalign's just growing. It's growing as fast as implants.
Yeah.
Do you see orthodontics taking off in Cambodia like implants?
Yeah, the orthodontics also keep growing very well in Cambodia because as you say that everywhere on the street you see the children. Yeah, that is the orthodontic market. Yeah.
Yeah.
Right.
And do you think a lot of dentists will hire dental therapists to do their cleanings? So, like in the United States, most of my dentist friends do not do cleanings.
Yeah.
They hire a dental hygienist, or it sounds like a dental therapist is a dental hygienist, right, and an expanded function duty assistant all wrapped up into one. Do you think in the future that you will hire dental therapists to do the cleanings so that you can be doing crowns and implants and surgeries?
There's some difference between the dental hygienist training in US and the dental therapist training in Cambodia. In US, you train dental hygienist to be like the third and fourth arm of dentist. Yeah, you can do like the chairside assistants, and you also train them to be like the one who can do the basic dental hygiene, cleaning, scaling, and some preparation. But the dental therapist training in Cambodia, they teach how to do extraction, they teach how to do filling, they teach how to do simple crown and preparation. So the mentality of dental therapists here, they don't feel like they are the chairside assistant of the dentist. They feel like they are the dentist. They will be independent. They will do the best in dentistry. So the different approach, and it may be difficult for them to come and help the dentist as the dental assistant because they already put themselves as the in the dental job, duty already.
Right.
Dentist duty already, yeah.
And it'll probably be confusing to the Cambodian people of really what is the difference between a dentist and a dental therapist. And they'll probably start blurring the lines thinking it's the same thing.
Yeah, I agree that, but if we are strong, we know that how to be strong. Yeah, we say that to know the power of the horse, you have to give them a long way to run. Yeah, so at the early stage, we look similar, like they also rule as dentists, we also rule as dentists, but in the long run, they will be different. The patient too, at the beginning, they will look for alternative solution to get a lower fee, but maybe one day they will meet some problem, they're struggling about there's a dental health problem, they will say, oh, now I know that this is not a qualified dentist. Yeah, we can go to them only some emergency work, but if we need a proper treatment, we should go for qualified dentist. So I don't say that we have to fight against the law, but I propose and think with my team that we have to fight ourselves to be stronger, to distinguish between the dental therapist and the professional dentist. Yeah.
I love that quote. To know the power of the horse, you need to give him a long run, and a long
road.
How'd you say it? To know the power of the horse?
To know the power of the horse, you need to give them a long road to run.
A long road to run.
Yeah.
Speaking of that long road to run.
Yeah.
If your dental hospital did 100 fillings on the posterior teeth, 2 or 3 surface fillings, and let's go with an MOD on a first molar.
Yeah.
If your dental hospital did 100 fillings on an MOD on a first molar, what % would be amalgam and what % would be composite?
I am practicing as the mercury free since my early stage, so we don't use amalgam at all in our practice. Yeah.
But to know the power of the horse, you need to give them a long road to run.
Right.
How long of a run do you think an MOD amalgam would last? And how long would a posterior composite last?
That is very controversial ideas. Like originally we start with amalgam. I also have some amalgam when I'm a student. It's still in the mouth for more than 20 years.
In your own mouth?
Yeah, in own mouth. And we saw the patient who had amalgam, especially those patients coming from Australia and British. Yeah, they also have amalgam. It lasts very long. We just like another thinking like amalgam can be a toxic, can be irritated. Yeah.
Do you think amalgam is toxic to humans?
Yeah, if you swallow mercury in certain amount, I will send you to the stupa quickly.
Say that again?
If you swallow mercury in a certain amount, I can send you to the stupa.
Send me to the what?
To Pagoda. Pagoda.
I missed that. What? No, if I swallow a little mercury.
If you swallow enough amount of mercury, I can send you to Pagoda.
What is that?
You die.
Right. But you have amalgam in your mouth.
Yeah.
So you must not think it's toxic for you, because you have amalgam in your mouth.
But this is very.
I have an amalgam in my mouth.
Yeah, it's very small amount. Yeah. It can be some toxic in certain amount, but we don't know how big it is. And also it already is it's setting with the silver powders, so it stay in one location. It maybe get some toxicity a little bit every day into your mouth, but in very minimum amount. Yeah.
Okay, so that's your dental hospital in Cambodia.
Yeah.
But what about the 1,200 dentists in Cambodia? What % of their restorations are amalgam versus composite? For all of Cambodia's 15 million people.
I have no idea, but most of the young Cambodian dentists, they will go for composite.
So mostly what you see is composite?
Yeah, mostly composite.
So you see amalgam going away?
Yeah.
And in your laboratory, are you doing any, what if you did 100 crowns on a first molar, what % would be gold? What % would be porcelain fused to metal? What % would be milled zirconium? Or to talk about if if your lab did 100 crowns, what
Yeah.
types of percent of each one would it be?
In this hospital, because we are doing more metal-free work, so it by generation. Yeah, in the early stage, we have no alternative solution. We do PFM, but after that, we start to have gold alloy from a good company. So we start to have gold ceramic material, and later on, we start with the zirconium frame. But when we see that the chipping ceramic from zirconium frame is a lot, so we give up the ceramic, bond to zirconium frame, and we move to the IMAC. So now in this hospital, maybe 90% of the ground we are providing the IMAC ground.
So when you're doing crowns over implants,
Yeah, also IMAC.
You use Emax,
Right.
From Ivoclar,
Yeah,
out of Liechtenstein,
yeah,
because the zirconium was chipping.
yeah. Zirconium is chipping. Zirconium doesn't chip, but porcelain bond to zirconium frame is chipping.
So porcelain to zirconium, porcelain is chipping off zirconium.
Right.
So you're doing porcelain to, so you're just doing Emax.
Yes, IMAC full ceramic. Yeah, and now the news paper say that the IMAX 1 millimeter thickness can stand up to 500 MPa compression
So
range.
porcelain was chipping off of zirconium.
Yeah, right.
So you went to all Emax.
Yeah, we
But
shift.
you could do all zirconium. No, not put porcelain on zirconium. You could just do all zirconium.
Yeah, now they start the full zirconium crown. Yeah, but we already have the CAD CAM. We use the IMAC,
And you like the Emax?
Yeah, we love the IMAC because it look nice, look better than zirconium. So we stay with the IMAC.
Would you say, it seems to me that at least 85% of all the crowns currently are Emax. Would you say that? It seems Emax is the world leader in crowns right now today.
I don't know for outside dentists and internationally, but just say what we are using and doing in our hospital, in Roomchang hospital.
Yeah, it seems like whenever I talk to a lab, or seems like anybody I'm talking to,
Yeah.
Emax is still the leader. But zirconium is definitely making a comeback. Back to your implants. You're a major leader in implantology. When you place implants, if you placed 100 implants,
Yeah.
what percent of the time would you use a surgical guide, or what percent of the time would you just hand do the surgery?
I do the surgical guide maybe 1 or 2 cases when I was in the training program at the early stage. Yeah, and after that I become a freehand guy. Yeah, brain guy. We call brain guy.
Will you call it what?
brain guy.
Brain guide?
Right.
Instead of a surgical guide, he calls it a brain guide. I love that. It seems, why do you think it is that whenever how many implants do you think you've placed?
Maybe 400, over 400 a year.
400 a year?
Yeah.
So how many do you think you've placed in your whole life?
No, maybe 4,000 or 5,000.
4,000 or 5,000. Why is it that every time I talk to someone who's placed over 1,000 or 4,000 or 5,000, or Carl Misch 20,000, they always do a brain guide. They just do the surgery.
Yeah.
But it seems, but the younger dentist, they think they always have to have a surgical guide. Why do you think there is? Why is that?
It's very simple. Either you are the trained captain who try on the track, or either you are the Formula One driver who try on this kind of road, in the city road. Or doing the surgical guide is similar to you try the train on the track. Yeah, they all straight setting there. Yeah, but unfortunately in the mouth, yeah, the mothers never put the rail into the bone, and the bone always have different condition, different step. Yeah, we believe on the CBCT that can provide a good morphology of the bone, but in the real situation, yeah, when you open and you drill, you also have some modification. You need to relocate a little bit or change angulation a little bit. If you do the guide, you are dead. And honestly speaking, yeah, there's some, I used to see the presentation in Frankfurt from a true practitioners. Yeah, they do the training, they do the testing with the full surgical guide in Italy, 2 different centers. Yeah, they make planning everything, they put the guy in the mouth, but with the full reconstruction, at the end they give up. Yeah, during the operation, they drill 1, 2, and the rest they drill by brain guide. Yeah, the other center also has a similar experience. So you can do the guide when there's a good support. Yeah, either you have implant crown support with one guide, one hole for the implant, or either you have natural tooth support and your guide is stable. But when you are full reconstruction from edentulous jaw, you may be very difficult to relocate the stent. Yeah, and your drilling may be not very accurate. Or either when you put the stent already, yeah, the position that you plan to put the implant at the early stage may be not favorable. Yeah, so you stick back to the brain guide. You start to relocate it. Yeah. So I don't know. I don't oppose with the science, the technology, but this surgical stand and technology was improved in the past 5 years, and now I don't know how they grow and develop, because I just say that if I do that, I have to spend extra money to pay for this work, and it means like the patient doesn't come to take my skill. The patient will come to take the computer skill to put in their mouth.
Right.
Right.
So what implant system do you use? There must be 175 different implant systems around the world. Which one did you go with?
I was trained by Professor Nanving from Frankfurt University. He is the inventor of ankylose implants.
Ankylose?
Yes.
Which is owned by Dentsply?
Yeah, now it's owned by Dentsply.
Ankylose?
Ankylose, yeah.
So you still use ankylose?
Right.
So how long have you been using ankylose?
15 years.
15 years?
Yeah, 16 years.
Do you have any friends at ankylose?
The inventor, Professor Nanving,
Yeah.
who is inventor of the implant, ankylose implant.
Yeah.
He is my guru.
I wish you'd introduce me to him. He lives in Germany?
Yeah.
I still am surprised that nobody that owns an implant system has put an implant curriculum on Dentaltown. I mean, if I was the inventor of ankylose or Megagen or Stereos, I would put a 25-hour course on how to diagnose, place, implants, sinus lift. No one's done that on the internet. So there's 2 million dentists around the world, and when they get on YouTube or Dentaltown or Facebook, nobody has done a complete online training, which I imagine would have to take. I mean, you couldn't teach a kid how to place implants in 3 hours.
Right.
But I'm still looking for that magical unicorn god. You could probably do it. You're the Marco Polo. You're the Marco Polo of dentistry. You've studied in 5 countries, but somebody needs to do the whole didactic training, because there's dental students in South America, Asia, Africa that are online trying to see someone walk them through from the beginning to the end of how to place implants. Yeah. And no one's really done that.
I see.
So you like the ankylose system,
Right.
and what about the CBCT? I promised 1 hour. I'll end quickly.
It's okay. We have time.
What CBC 3-dimensional CAT scan did you go with?
We are having now is Myray from Sofla.
Myray?
Yeah.
From Sofla?
Yeah.
Is that French?
Italy.
Italy.
Yeah.
Ryan, can you find that website? CEFLA?
Yeah, FLA.
And do you think some CBCTs are better than others? Why did you pick the Cephala from Italy?
The reason that I pick it because maybe the cost is not very expensive, and also I use their dental chairs. I use others equipment from them. They are reliable. The price is not very high, and the maintenance is convenient. Not very big problem. Easy to fix the problem, and the support team from overseas also very good.
And another big controversial question with implants is whether you should cement the implant or screw it down. Do you cement or screw?
I always cement. I don't like the screw.
Why do you not like the screw?
Because I feel like the patient come for crown, they also get one free filling.
Because you got to do a filling for where the screw went in.
I don't want to give the filling for the patient. The patient come for the crown, so I give them a real crown, not a filling.
Nice. But a lot of people say that the do you think this is true or false? Some people think the number one reason that implants fail is because of excess cement, where they cemented the crown. The excess cement gets around the implant and causes peri-implantitis.
It's true that when you do cementation, you don't clean well, you will get peri-implantitis from irritation. Yeah, but it's not true that the cementation crown will have problem to the peri-implantitis. If you do a proper cementation technique, you can remove all the residuals and the crown will last for lifetime.
A lot of implant cements are not radiopaque, so if there's excess cement, you can't even see it on the x-ray. Do you use a radiopaque implant cement?
Yeah, we use a GIC product.
GIC?
Yeah, the clionomous luting cements, and it's radio opaque, so we can detach it, we can clean it out.
So GIC, is that made by
GC?
By GC?
Right.
Which is out of Japan, but I guess they just moved their headquarters to Switzerland.
To Switzerland, yeah.
Now, did they move their company to Switzerland, or is that just a tax advantage?
No, it's just like the president, he moved to live in Lausanne, Switzerland. Yeah.
So the president of GC moved from Tokyo to Switzerland to live?
Yeah, to live, yeah.
And do you know why he did that?
He's old. He want to have a very comfortable life. Yeah, Lausanne is a rich community. Maybe it's good for him because he have billion of money.
I don't know, because Tokyo is as nice as it gets. I've been to Tokyo.
Yeah, you stay in Tokyo, it's nice, but once in a while you see the stroke by earthquake, you feel heart attack. Yeah, maybe living in Switzerland is more peaceful.
I wondered if it was for a lower tax rate. I mean, I have no idea.
I have no idea about that.
I have no idea.
Just like he want to position himself as the biggest dental supply company in the world in the year 2020.
He wanted to what?
The world largest dental supplier.
He wants to be the world's largest dental supplier?
Yeah.
By 2020?
Yeah.
And do you think GC will do that?
Very hard to say. Yeah.
It would probably take some mergers and acquisitions. He'd probably have to buy some people.
Yeah, if he can buy Dentsply together with GC, it should be enough.
Yeah. It'd be a lot easier to buy your way than do that with internal growth.
Yeah. But now you see this Dentsply joined with Sirona, so it become very enormous already.
So you cement your crowns with GC's glass ionomer. You call it GIC?
GIC, right.
Glass ionomer cement.
Yeah, right.
And it's radiopaque.
Radiopaque, right.
So you can see the excess.
Yeah.
So my final question, and thank you so much for your time. Why do implants fail? What are the top 3 reasons why an implant would fail?
The failure of the implant, one is the skill of the dentist. Yeah. The secondary is the material. Yeah, the implant design and implant material itself that is not strong enough. The design is not very stable. Yeah, and the third one of failure is because of prosthesis design. Yeah.
Well, it's funny because you could say the same about Ryan. Let's look at the stat. What percent of airplane crashes are pilot error? So you would say that the number one cause of implant failure is dentist error.
Yeah, dentist.
Just like when a plane crashes,
Right.
it's pilot error.
Pilot error.
And when a implant fails, it's dentist error.
Yeah.
And what do you think those errors are?
Your diagnostic.
You what?
The diagnostic.
The diagnosis?
Yeah,
So the diagnosis is wrong.
it's wrong. Yeah, and also the skills when you put inside the bone, you don't have a proper tool, or you don't have a stable hand to drill it, and the socket for implant is larger than the implant diameter. Yeah, you can insert it deeper, it gets primary stability, but there's a gap between the implants and the bone, and during the healing time the soft tissues growing inside and create the gap, so you see the bone loss from early stage. Yeah, that is the human errors. Yeah.
And do you think there's another error of, do you think dentists do too many immediate loads and should let the implant heal first before placing a crown on the tooth?
Yeah, actually, it's I like to do immediate loading. Yeah, we see the failures is a little bit higher. Yeah, when we do immediate loading, especially with the very limited bones capacity, but it worked very well most of the cases.
What percent higher failure rates do you see in immediate loading versus non-immediate loading?
If you do immediate loading with a very limited bone capacity, your failure rate can be 25%.
Higher rate of failure?
Yeah.
And another question they have is smokers. Some people think that placing implants in smokers has a higher failure rate. Other people say they don't see that.
Actually, I believe that for heavy smoker, during the healing period, they can affect to the surface of the implant if you do non-submerged healing. Yeah, but if you do submerged healing, it should be the same result with similar to the non-smoking patient. Yeah.
Do you know what percent of Cambodians smoke?
I think that we are very small percentage of smoker in Cambodia, less than 10%.
Less than 10% smoke?
Right.
And what do you think it would be in China?
Maybe, I don't know, 80%.
So why do you, because I agree with you. I mean, the joke is in China,
Yeah.
that they have in the restaurant they have the smoking section,
Yeah.
and the chain smoking section.
Right.
Why do you think smoking is so much more common in China than Cambodia?
I think that is the culture.
Just culture.
Right. Yeah.
Now the United States in 1950 half the adults smoked,
Right.
and now in 2017 it's less than 20%.
20%.
It's actually I think it's down to 18%. So the United States went from 50% down to 18% from a lot of public awareness.
Yeah.
But I notice in some places it's coming down, like when you go to Europe, like France
Yeah.
and Spain and heavy smoking countries, you're starting to see downward pressures on you can't smoke here, you can't smoke
Yeah.
there.
Right. Control.
Yeah, and so do you think they'll start doing that in China?
In China now they start to have non-smoking hotel. They start to put the ban on the public areas. Yeah. So
Yeah.
they will improve, and yeah, if they really, the government really want to support the non-smoking policy in China, they will be very, very fast effective, like the drunk and drive in China. In the past, in China, you drink and drive everywhere, but recently government put 5,000 penalty when you are drunk. Yeah, so
5,000?
Right.
5,000 US dollars?
US dollar.
In my where I live in Phoenix, Arizona,
Yeah.
it's 10,000
$10,000.
US dollars.
Yeah, but the
to
money
drink and drive.
in US is bigger than in China. So 5,000 for Chinese is a lot.
Yeah.
In Cambodia, if we put 5,000 penalty for driving, we are so very effective. You will sell the house for penalty.
Well, it was an absolute honor that you let me and Ryan come by today and podcast interview you. Like I say, I've heard about you in Singapore, Hong Kong, Kuala Lumpur, Malaysia. You're a legend. You've studied in Cambodia, Vietnam, Hong Kong, Malaysia, Germany. You're amazing. I hope someday you build us a course on Dentaltown. But thank you so much for sharing your story with all my homies today on Dentaltown.
Thank you very much, sir.
Thank you very much.
Thank you.